Hello dear followers and our patients. I'm Dr. Ahmedov, hair transplant surgeon from Smart Hair Clinic. Good to see you all on our YouTube channel. Today I would like to share with you the history or story of one of our patients who underwent a two-step surgery in our clinic. Our patient is a 45-year-old male. He has a Norwood type 5 of the hair loss. What actually the Norwood type 5 means? First of all, when we plan the hair transplant surgery, the first thing we do, we stage the hair loss stage or grade of the hair loss for the patients. For this purpose, we use the Norwood Hamilton scale. On Norwood Hamilton scale, the patient are staged from grade 1 to grade 7 of the hair loss. 1 meaning the least of the hair loss, 7 of course meaning the most of the hair loss. Our patient had the Norwood type 5 of the hair loss. What does Norwood type 5 of the hair loss actually mean? It means first of all, the loss of the continuity of the front hairline. You have empty spot on both temples. We have deep recession of the temples. We have an empty spot in the front forelock, front third. There's thinning in the hair loss in the mid scalp and an open spot in the crown area. So basically all three anatomic areas were affected by hair loss. For this type of patients, on average to cover all the open areas with almost more or less the same density, we may need something between 4,500 up to 6,000 grafts. Of course, number of the grafts for the patients may vary from patient to patient depending on the size of the open area, the density you want to get, expectations of the patient, but the most important here is the capacity of the donor area. And we had a challenging situation for our patient, and the point is next. The capacity or the ability of the donor area was not enough to give us sufficient number of the grafts to cover everything in a single surgery. As a general rule, most of the time we say for the Norwood type 5 or in some patients starting from Norwood type 4, you may need a two-step surgery. The two-step surgery is technically the most correct surgical approach for the progressive type of the hair loss. It may be at least 2 surgeries, but for some patients we may need up to 3 surgeries. Okay. The plan for our patient, 44-year-old like white male, was the reconstruction of the front hairline, rebuild the front hairline, make the frontotemporal transition a more accurate and appropriate, reinforce the front forelock, cover front third, and depending on the number of the grafts, try to cover at least like one part of the mid scalp. We always tell our patient that at least around 60 to 70% of your final outlook is this front side and the mid scalp. So when we take this side, that's the most visible area. So when we're doing the reconstruction, the first area that needs to be rebuilt is the front side, because this is the frame of your face actually. And that's how people see you. The biggest challenge is that loss of the front hairline is that your forehead goes directly into the scalp. So there is no like demarcation line or frame of the face. So idea number 1, we have to rebuild the front hairline, reinforce it and make it more visible. That's what gives you an identity. Okay, so the plan for, we planned a two-step surgery. With the first surgery, rebuild the front hairline, cover the front forelock, front third, and a part of the mid scalp at least. The number of the grafts we were able to get from his donor area was 3,200, but this number would not be enough for us to cover like the most needed areas. So we also planned for some body hair transplant, and we extracted 450 grafts from his beard, around 400 from his chest region. So all in all, the patient had 4,250 grafts transplanted to him. Here you can see on the picture is that we designed a new hairline, mark the areas that needs the slightly highest density. The front forelock or front tuft, that's a very important area for the hair reconstruction surgery because it should have a good density to give us a fuller look in the front side, and the priority areas were marked. So, and with this number, we were able to cover, as we have planned, the front and the one part of the mid scalp. Here you can see the picture of our patient immediately after the surgery. The most marked areas are covered. The transition from the front side to the temples are covered. This is immediately after the surgery, pictures of our patients. And after that, now I would like to share with you the result of the surgery 1 year later. So the patient came to the second surgery to cover crown area and reinforce the areas where they had a slightly thinner hair. And you can see our main purpose, the reconstruction of the front hairline, that actually the frame or the bore of the face is rebuilt pretty natural. An important aspect here is that also the patient should know or should apply a good or like an appropriate haircut, so the transplant looks much more natural. And you can see how it has went. You can see that the front side is rebuilt, slightly thinner hair at the beginning and slightly like denser at the back. That's how the hair transplant or hair actual natural grows. The very front side is slightly thinner, and at the back it goes slightly with the higher density. The most important thing here, or one of the pitfalls you need to avoid with the hair transplant surgery, or when we do the hair transplant surgery actually, the frontotemporal angle or frontotemporal transition, that's one of the most important areas where when we work, we need to rebuild pretty accurate, because the direction of the hair is different. Temples grow slightly downwards and to the inner side, and the front side has a small tilt or turn to the inner side of the hair. So when we look for the hair transplant surgery, the first thing we pay attention is the frontotemporal angle or frontotemporal transition point is rebuilt appropriate. And you can see that it's a very natural transition from the front side to the temples. That's very important for us when we rebuild it. So avoid one of the pitfalls is that frontotemporal angle. And the patient actually was very happy, and we plan to do with the second surgery to cover most of the crown area, and depending on the number of the grafts, also try to cover increased density in this very front line, okay, and in the mid scalp. Again, for the second surgery, we planned to do the maximum extraction. It was a partial no shave surgery. And for the second surgery that we carried out around 1 year later after the first one, our plan was to preserve the same hairline, reinforce or increase the density in the very front side. We call it touch-up surgeries or densification surgeries, and also reinforce front forelock. And after that, as you can see from the picture, we preserved the front hairline, marked the areas that needs most of our attention, implantation areas, and of course we didn't want to forget about the main area for us. That's the crown area. We didn't touch it the first surgery. For the second surgery, again, the final number of the grafts was 3,700. We were able to get around 3,000 extra from his donor area again, and the rest around 700 from his beard area, or we did a kind of body hair transplant surgery. And now I would like to share with you a 9-month result after the second surgery. You can see the front line is again with the second surgery we increased overall density, so it looks much better, because as we have told for the progressive type of surgery, we may need a second or touch-up surgeries to increase overall density. We try to cover the crown area better. Yes, it's not a high density, but again, it's not as empty as it used to be. The important point about the crown area is the reconstruction, because reconstruction of the crown area is slightly different. It has a hole or the twist, so you need to mimic that spiral direction of the hair, so when they grow they lay over each other and give us a better coverage. And finally, that frontotemporal transition point is also very stable, very natural. The direction of the hair, the angle of implantation, they all played a huge role, so the patient has a natural outlook. The idea of the hair transplant surgery, we should not forget, is not to give the patient a super high density. It's not the aim. The idea for the hair transplant surgery is to create a good illusion of the hair. It's like a good outlook of the hair, appropriate haircut, direction of the angle. So we do the implantation the way when the hair grow, they interlock with each other and give you a better coverage, but it may not be the dance you've had when you were 20s, for example. Thanks for being with us. If you have any questions, you can write the comments underneath the video and we'll be glad to answer them. Best of luck and see you soon.